Hello, and welcome to another episode of the Med School Minutes podcast, where we discuss what it takes to attend and successfully complete a medical program. This show is brought to you by St. James School of Medicine. Here is your host, Kaushik Guha.
Welcome to another episode of Med School Minutes, and today we have a set of very interesting guests. We've always talked about, or at least from our viewers, there's a lot of debate about how good Caribbean medical schools are and how good U.S. medical schools are. You know my opinion. My opinion is always that I think certain Caribbean medical schools are as good as any U.S. medical school. But in order to lay that question to rest, we have two experts with us who will give us their opinion as to what's what. So without further ado, let's welcome our guests. Dr. Majed, would you please introduce yourself?
Youssef Majed. I'm currently the DIO and the Chief Academic Officer for South Texas Health System. I bring with me about 16 years of experience in medical education.
And could you explain what a DIO is and what it actually does?
A DIO is designated institutional official, oversees the programs, the ins and outs of the education program that pertain to ACGME.
Okay. And Dr. Deena Mohammed, why don't you introduce yourself?
So Deena Mohammed, I'm the medical director for one of the largest ACOs in Texas. We have about 30,000 live charts. We manage value-based care, so very high volume of Medicare patients, and I work in direct contact with the St. James medical students.
All right. And you are also an alumni of St. James.
Absolutely.
All right. Could you explain what an ACO is? Because I think a lot, not just our viewers, but I know a lot of even physicians don't really know what an ACO is.
Yes. So we basically manage our patients in a sense of we don't refer outside. And we have a group of doctors that work directly with us. So in the case that, let's say we have a patient that has a heart attack, there are value-based care hospitals now in McAllen. So the McAllen Heart Hospital is a value-based hospital where when a patient goes in, there are coordinators, there's a social worker, there's, a home health nurse practitioners, physician assistants, so that we could make sure that the stay of the patient is not 10 days. We like to limit the stay, limit complications, limit procedures, limit all costs possible in terms of imaging studies, whatnot, to limit the cost on the insurance companies and make sure that the patients get the best quality care so that they could be discharged to preferably home or, an inpatient rehab facility to prevent progression of their disease or limit any disadvantages of their stay in the hospital.
Okay. So this sounds like a ultra elite clinic.
Absolutely. Yes.
Okay. So this is like the Rolls Royce of clinic. I don't know if there's any other car better than that, but I mean, it sounds like if the average clinics are Toyotas, this is like a Rolls Royce. And what was the volume you said that you guys know?
So we have 30,000 live Medicare patients.
30,000.
Yes.
I mean, Dr. Majed, you've obviously dealt with a ton of hospitals. What's the average in and out of like a census in a Chicago hospital here?
So on a small community hospital, probably I would say 70 a day.
70 a day.
70 a day, yes. And on a clinic like that with 30,000 life, you're talking, and correct me if I'm wrong, about 150 to 200 patients a day.
Wow. 250 plus.
So your clinic is probably seeing 3 to 4 times more than a nice sized hospital in Chicago.
Absolutely.
That's crazy.
So when our drug reps come in, they are shocked because we have 3 different rows of providers.
Oh wow, okay.
And it's like an acute medical facility. It's an acute care hospital.
Awesome. So we've always heard this debate. We see a lot of comments on social media where people say that, if you go to a Caribbean medical school, it's the end of the road. Yada, yada, yada. We just wanted to get some experts like both of you. Both of you are IMGs, if I'm not mistaken. And both of you deal with students. You've actually deal with students on the other end as well, right, Dr. Majed? Why don't you actually tell us a little bit about what your current projects are so students get a basic idea of the depth of your background?
Sure. So currently working on establishing and accrediting 7 residency programs for South Texas Health System GME Consortium. We do expect the first batch for IM, family, and ER to start in July of 2024, and the rest of the programs, neurology, pediatrics, psych, surgery, transitional years, and so on, will be launched next year. We're looking at the next 4 years to have 8 to 10 fellowships as well.
Okay. So you obviously deal with a lot of IMGs, or have dealt in the past with a lot of IMGs, and definitely are currently dealing with a lot of US residents. And if I'm not mistaken, you are actually dealing currently with a lot of US medical schools as well. Am I right?
Correct. So we do have an affiliation with the US medical school, and I have worked tremendously with Caribbean medical schools and international medical schools.
Okay.
I worked with St. James for our relationship back in 2009.
Mm-hmm. Yeah, 2009.
Yes.
So, again, some of our viewers say, so my opinion is that I think Caribbean medical schools, especially St. James, is just as good as any US medical schools. I know a lot of our viewers disagree with that. But what's your take on that? Is it true that if you go to a Caribbean medical school, that's the end of your career?
Absolutely not.
Okay.
In a nutshell, no, it's not the end. It is not the best route, but it's not the end.
Okay.
And I'm going to be fully honest. The biggest difference you see with a good established Caribbean medical schools like St. James, for example, and an American school is the support, the amount of the support that is available for students. And with all fairness, most of the schools here, I would say more than 90+%, they're non-for-profit.
Right.
So they do have the federal and the governmental grants for so many resources that is not available, or if it's going to be available from a Caribbean school that is for-profit, that's going to be at an expense that is out of their pocket. And that's a lot of money.
Okay.
So support, I would say, number one, is a huge difference.
Okay.
But curriculum, everything else the same. The human anatomy,
right.
Everything you see is still the same.
Right. Dr. Mohammed, as far as you're concerned, would you agree or disagree with the statement that if you go to a Caribbean medical school, your career is over?
No. It's what you make out of yourself.
Okay.
So if you are focused on becoming a doctor, sometimes, unfortunately, students, I see them, they take the MCAT and they don't score as well as they would hope to. Mm-hmm. But then they score higher than the American students on their USMLE.
Okay.
Going to a Caribbean medical school.
Okay.
So it's what, there may have been a death in the family, there may have been struggles, and they did not get into an American medical school, and they thought maybe it was the easier route to get into a Caribbean medical school, but it's really what you make out of yourself. If you are focused and becoming a physician, you will become the best physician from any school.
So one thing I always want to bring up is that at St. James, the entire program costs about $103,000 to $104,000. In a U.S. medical school, the average cost right now is about $250,000. That's a significant difference. And I always say that that cost differential of $150,000. So our first time match rate this year was about 85%. The across the board match rate in the US medical school is about 95. So my argument always is that you're paying $150,000 for a 10% differential in risk. So if you believe in yourself, I always say that, if you truly believe in yourself and you're disciplined and you work hard, then save that $150,000 and come to an accredited medical school in the Caribbean, like St. James. What are your thoughts on that, Dr. Mohammed?
So I agree. When it comes to expense, yes, it's even more than that. Some of my friends have, $500,000 in debt from U.S. medical schools. But at the end of the day, when I work with these students from St. James versus University of Chicago, University of Illinois, Chicago, unfortunately, the U.S. medical students are not brighter than the St. James medical students. They all take the USMLE by the time that they get to me, so they pass the same exam.
Right.
For Caribbean medical students, maybe the passing score is higher now that they changed pass-fail.
Right.
But again, if I have a U.S. medical student that had a 220 on USMLE and then St. James students that scored a 260 on USMLE, there is a large margin in terms of their medical knowledge.
Okay.
So St. James students by far push themselves harder and they perform better, in my opinion, compared to the students that it's kind of given to them in a sense, it's just the title that I came from University of Chicago or Northwestern or whatnot. But it's really, again, what you make out of yourself.
Okay. What about you, Dr. Majed?
I have a slightly different opinion on that. Mm-hmm. So the way I look at it is, at the end, if you're looking at the outcome,
right,
and given the higher chances that you have in matching coming from an American medical school, to me, that insurance, the extra money is worth it.
Okay.
On the other hand, Caribbean medical schools, and I don't want St. James to bring the good reputation to all Caribbean medical schools, because there are stigmas in that
Absolutely.
region. If we're talking specifically about St. James Medical School, yes, great. I believe this is an opportunity. Mm-hmm. And like Dr. Mohammed said, that some people don't score well under MCAT, etc. It doesn't make them bad students. It just they had a bad day. And then unfortunately, this is your score. And that determines your admission. Right. So there's more competition here. So St. James becomes an opportunity.
Okay.
For real students, for students who are truly seeking to become physicians.
Right.
One thing is, so the admission criteria in general for the Caribbean medical schools, there's a stigma there that pretty much the benchmark is a little bit low. And then any student could be going in and then end up being weeded away at the end of the 5th semester or failing step 1 or step 2. And that brings, again, that bad reputation to all Caribbean schools.
Right.
If I were to choose myself, saving $100,000, I'd probably go to St. James, but that's me personally.
Right.
If I know myself that I need the support and I know that I need a good structure, I need the dean to vouch for me in case I barely pass my exam. Not necessarily, I believe the American students are less brighter or not. I do agree, on the other hand, foreign medical graduates will have to work harder to achieve the same position. Right. That does not make them brighter. No, that makes them that they put way much more effort for the same outcome.
Got it.
If on the other hand, I'm a mediocre student and I need a structure and I need resources, definitely it is worth it for me to pay that extra $100,000 and then go for an American school, whether it's an MD or a DO even.
Okay. So it almost sounds like it becomes like a situation of personal preference as opposed to, a bad decision, so to speak. So neither seem to be, from what I'm hearing, and jump in and correct me if I'm wrong, but you do not think going to either a U.S. school or a Caribbean school can potentially be a quote-unquote bad decision?
No, because at the end of the day, you see there's a smaller percentage also in the American school who don't make it.
Okay.
They go in, and I've met. I was an advisor at Kaplan downtown for the longest time. I used to work with people who struggled with step 3.
Okay.
One person in particular was going to be kicked out of the residency at one point. So I used to get referred to the, I don't want to say call students, but students who are struggling with taking a test, not passing it, or they go maybe through depression. They think the load is too much. So some of the students end up truly struggling. But what happens here, the whole team jumps in and try to support that students and put them back on track.
Okay.
While if I feel in the Caribbean, like, look, you're saving $150,000 here. I cannot afford a psychiatrist for you 24/7 hotline.
Right.
So you need to deal with this.
Okay.
On your own.
Okay.
You see now the difference?
Right. Okay, that makes sense. What about your thoughts, Dr. Mohammed?
So in choosing an American medical school as well, sometimes that MCAT is what pushes you. So you have to wait. Sometimes you don't make it for the admission. So that's a year gap. So I've seen students waiting a year, 2 years, 3 years even to get into an American medical school because, again, it's a name. We don't want to get titled as a Caribbean medical student. They end up going through different routes. Some of them become dentists and then do, surgery as a dentist. They go back to medical school as a dentist. In terms of the monetary value, if you can get into an American school, absolutely get into an American school.
Right.
But if for any reason you do not get into a medical school, do not hold back your life. St. James was great for me. I graduated on time, so long as you are dedicated.
Right.
And again, with all due respect, the American students are absolutely wonderful. They're very bright, very, very bright. But like Dr. Majed said, if you push yourself, you do have to push yourself. So, on the step 2, a 260 is equivalent to a 220 for an American student. But with all due respect, they're both wonderful.
Right. So keeping that in mind, I know we've talked a little bit about how American students, quote unquote, have it easier, so to speak. However, have you seen somebody who's matched into residency from a Caribbean medical school? And I know both of you have I think between both of you, I have nearly half a century of experience in front of me. And that is about half a century of experience. But have you ever seen somebody who's actually matched into residency? After that stigma really following them throughout their career of being a Caribbean medical school, is the stigma just at the residency point? Because again, I mean, with our match rate this year at 85%, it's almost like as time is going on, the stigma is going away, so to speak. And Caribbean medical schools are number one. As Dr. Mohammed, you pointed out, they seem to have a reputation of being harder working. They seem to have a reputation of going the distance. They seem to have a reputation of being entrepreneurial because they're carrying less debt. Keeping all of this in mind, do you think that stigma is changing? And once they get into residency, do you think that that's holding them back at all? What are your thoughts?
No, so it's not really residency. It's once you come out of residency and in true practice. So as a hospitalist in Chicago, there were patients that asked me, where did you graduate from? What was your degree? Why did you go to a Caribbean medical school? You weren't smart enough to go to an American medical school? And I said, no, at the end of the day, this was my path that I chose. And at the end of the day, we both take the same exam. We have to take the USMLE. We have to take the internal medicine boards. And it's a nationwide exam where anyone from any country has to pass this exam. It's the same medical knowledge. You could go to 3 different residency programs and train under 3 different doctors. And this happens a lot. You'll see it, when it comes to specialties. You'll round with 3 different cardiologists or 3 different infectious disease specialists, and they will have a different approach to treat the patient, different medications, but the same outcome at the end of the day. So this is how we see it with the Caribbean medical schools. Again, you're taught the same information. You may be trained a little bit differently, but you're still treating the patient at the end of the day. And there could be 10 drugs to treat heart failure, but at the end of the day, you're trying to preserve the heart function. And no matter what medication you choose and kind of play around with, depending on your level of training, it's the same outcome.
Dr. Majed, any thoughts on that?
Well, I agree with that.
Yeah. So, so essentially, if once you finish residency and you get board certified, am I saying this correctly, that whether you come from a Caribbean medical school or any other school outside of the United States or from Harvard, you're essentially on the same footing? Is that...
Pretty much for the most part, more than 90%, you're absolutely correct. And there's that old saying, C equal MD.
Okay.
So...
How about you, Dr. Mohammed?
So now in the primary care setting, I'm working closer with the nurse practitioners and physician assistants,
Right.
and I have my patients calling them doctors.
Okay.
So it's kind of like, okay, well, this is the doctor. You don't have this obnoxious patient that's,
Right.
again, asking you what medical school did you graduate from and what was your GPA in medical school. At the end of the day, they're getting the care that they want,
Right.
and that's what we're providing for them.
I mean, the fact that you pointed this out, that patients would try to make this, ask you, does that matter at the end of the day, though? Because at the end of the day, the patient is there. If they say that they do not want to see this doctor, I don't think they have a choice. Like, a hospital will send the most competent physician to a particular round. And if the patient doesn't want to be seen, you don't get seen at all, and you wait until the next round happens. Am I right?
Yeah, so patients do have the right to choose if they feel that their doctor is incompetent, in a sense that the doctor rounded at 11 o'clock at night rather than 10 a.m. or 9 a.m.
Okay.
They do have the right to choose. But ultimately, they cannot choose a different provider based on what school they graduated from.
Okay.
No, that's discrimination.
Right.
Because the hospital will not hire you. There is, I mean, credentialing at the hospitals takes about 3 months. The same thing, if you want to work for a primary care doctor. The licensing, we went through the licensure in Texas. So it's a significant amount of paperwork that you have to provide. And you will not get a license, in one of the tough states, New York, Texas, California, if you did not complete, the process. Exactly.
Right. There's another, I mentioned this earlier, that IMGs tend to be a little, significantly more entrepreneurial. Not in terms of research and inventions and discoveries, but more in terms of the business side of things. And I believe a lot of hospitals tend to favor that adventurism, if you will. And from what I've read, is that's largely because a lot of IMGs, a vast majority of IMGs, are coming out with dramatically less debt than an American student. At an average, most of our students actually have little to no debt, or if they do, it's about $150,000 debt, which typically they end up paying off in about a year to a year and a half post-residency. What are your thoughts on that? Is that true? Is that not true? I mean, from your life experiences, what would you say, Dr. Mohammed?
So there have been doctors that unfortunately do not get the job that they had hoped for because they signed, a contract with a hospital that's paying off their loans.
Oh, okay.
That they work with, and Dr. Majed can speak more about that. Regarding having the hospital pay off your loan if you work for, an underserved area for about 10 years or so. Caribbean medical schools, yes, because of their low debt. We were interviewing a program director that may not get the position because we can't pay off her loans. Okay. Or the hospital in particular cannot afford to pay off the loans. But in another sense, at Christ Hospital where I worked in Oak Lawn, the program director of internal medicine was from an international medical school who now became the CEO of the hospital. Okay. So yes, he has jumped he was medical director, he was CMO, and, he jumped many bridges because of course he doesn't have the debt to worry about. Right. But now he's on top of the entire system. Right.
What about you, Dr. Majed? I mean, you're actually in a position where you are literally living and breathing these resumes day in and day out right now. So the question is, it seems like, or the general perception is that IMGs tend to be a little more entrepreneurial from a business standpoint, which is more favored in hospital systems than U.S. graduates. And that's largely because they're kind of, quote unquote, for lack of a better term, crippled with debt.
So if here we're talking post-residency, when both have a job.
Yes.
So in that case, if they both make it into residency, and yes, maybe if you have less debts, you might have more opportunities for you on the tables to choose from.
Okay.
And one simple fact, like Dr. Mohammed mentioned, that people who come out with debts, they look at underserved non-for-profit organizations that they could work there for 10 years, and they offer, it's called the forgiveness program. So they make payments for 10 years, and then after that, that's it.
Okay.
The rest of the loan will be forgiven. On the other hand, let's say now the same person who's working for this entity that offers the forgiveness program, but they're paying, this is just an example, $100,000 a year. Now another hospital or entity offers them $200,000 a year. They would rather stick with the first one, getting less money, because the second one does not offer that forgiveness program. But if I did not have the debts, I mean, common sense to me,
Right.
if I'm gonna just move next door to in order to care for patients, and that's what I do, I don't care. I
Right.
was just going there for the extra buck,
Okay.
providing the same quality.
Okay.
Yeah, it's not just a hospital setting. So also, if you want to open your own primary care office or your own practice, if you have, $500,000 in debt versus $200,000, of course you have more room to, open that practice or get an additional loan to open that practice.
Okay.
So the debt, yes, has a big role.
So now I have a question. We're switching gears a little bit. Now we really talked about Caribbean medical schools versus U.S. medical schools. And I think the general consensus is that it's not a one-size-fits-all answer. Because I'm going to be honest, at St. James, we actually have a significant portion of our students whose families make less than $110,000. That's not necessarily below average, but that's right around the U.S. national average. A typical family like that cannot even dream of sending, forget about one kid, both their kids to medical school. And we have several families sending both their children to our program. And I think that's a pretty big deal. But so to your point, it really is a matter of taste, choice, and appetite for risk. But there's no essential wrong decision. However, my question to you now is, we're switching gears a little bit. Are all Caribbean schools made equal, and does it make sense? So some of the bigger, older Caribbean schools in the Caribbean cost as much as $40,000 more than a U.S. program. In your mind, does that make sense to go to that kind of a program? Dr. Mohammed?
To me, no. Again, it's what you make out of your opportunity. So I have students that come in, they clock in, and they can't wait until they leave. I know what kind of physician they're going to be. And then there are students that stay past the time that they're supposed to. They come in extra on the weekends. They help with the other providers, not just with me. And again, it's a big difference in terms of, you can tell their scores are higher. You can tell that they're eager to they want to become the anesthesiologists, the general surgeons.
Okay.
The ones that just kind of come in and say, okay, when are we done? Or when is it time for lunch? Maybe psychiatry or something a little bit lower.
Right.
But it's what you make out of your experience. It doesn't matter what Caribbean medical school you're going to. You're not going to Northwestern. They are all Caribbean medical schools. So it's what you make and what you score that will pay off for you in the future.
Okay. What about you, Dr. Majed? Do you think brands within Caribbean medical schools make any difference?
It does and it does not. Depends who are you comparing.
Okay.
And I know I mentioned that before, and somehow some in general, some people did not like that classifications that I have. I classified Caribbean medical schools into 3 tiers. Tier 1, 2, and 3. The tier 1 are the ones that are accredited with the brand name.
Okay.
And the tier 2, they're accredited. They have the name, but they're not the Nike. They have the Bikey.
Right.
And then you have the third one, which is the one that actually started this whole conversation,
Right.
that they don't belong in the Caribbean at all.
Right.
They just, I believe, with all due respect, they just need to shut them down.
Right.
So if you're comparing the first tiers to the third one, absolutely, I won't even consider the third one.
Okay.
But let's compare 1 and 2. 1 and 2, absolutely not.
Okay.
Because I'm going to go to the cheapest one. And here's, I'm going to give an analogy. I love analogies. So one time I went to a gym without mentioning the name.
Right.
And the membership was like $300 a month. And they start showing me the swimming pool, the massage that it does, all these beautiful amenities that I don't use.
Right.
And then I end up going to another one that opens 24 hours this time. It has way much less amenities, but it has the machines that I want.
Right.
So the basic machines on both ends are the same.
Right.
The difference now are the amenities, extra ones. So to me, I looked at it, says, I come in, I work out 45 minutes and I'm out.
Right.
I don't care about your Olympic pool and whatever, and I don't need to pay for that.
Right.
That's the same thing when you compare medical school tier 1 and tier 2. Both accredited, both have good reputation. One of them is going to offer you a little bit more amenities, but guess what? The price is hefty, and I'm not willing to pay for it. Personally, I would not. So if you make me choose between St. James and let's say another school that is more expensive for whatever reason, I'm going to choose St. James.
Okay.
And if you tell me St. James versus another school that is, again, accredited and it's been there, they have the reputation and it's cheaper, I'm going to choose that with all fairness.
But this leads me into another question. And, you know, I've been in medical school management for, almost a decade now. Why are these other schools so expensive? Like, why are they more expensive than US schools? I don't get it. US schools, I get why they're expensive because they actually do a lot of research and somebody has to fund the research. Because St. James is practically the only medical school in the Caribbean that actually has a research program. The other schools don't. So what makes them so expensive? And I truly don't have an answer to that. I don't know, since you guys are in the field and deal with a lot of students and a lot of practitioners who have graduated from, maybe you guys can give us a little more insight into that.
So I think from what I know, like Ross Medical School, they have their hands on a few hospitals or multiple hospitals. So they have a direct affiliation. Let's say New York, almost all the hospitals that are IMG friendly are run by Ross, and no other Caribbean school is allowed to have their students rotate there.
Okay.
So I think that may be an advantage as to why some students may choose Ross or St. George's. Maybe they know, they tell them we have 300 hospitals that you could round out, and you could make a connection with these, with the residents or the program directors, and it's almost guaranteed that you'll get residency at the end of the day.
Okay.
Partially, this is very correct, and that goes down again to the amenities.
Okay.
So when you have about 115 sites to offer for your students, these hospitals, say sites, I'm talking hospitals, these hospitals need, without mentioning anyone's name, they need to be maintained. They cost money, you need administrators, you need to list them on the accreditation application, you have head directors, visitations, so it costs so much money just to maintain and give these choices.
Right.
To me, again, it is not worth it. If St. James have, let's say, 2 or 3 major sites, and this is sufficient enough to get my license and get accepted into residency and be board licensed later on down the road, this is more than enough for me.
Okay.
Why do I care? It's not a matter of convenience for me.
Right.
I just have to go ahead and work around the schedule and the affiliation that the school has. If they don't have a hospital next door to my house, too bad. Then I will have to travel to do these rotations.
Right.
And that happens also with the American schools.
Okay.
Typically, you might get you're from DC and you might end up accepted in Florida, and then you move to Florida.
Right.
And then that medical school, if it has affiliations in Florida and they have some away rotations, you end up traveling to finish your rotations. It's as simple as that.
Right. Okay. Well, again, I mean, thank you so much for taking time out of your busy schedules and really putting to rest a lot of the questions that our viewers have been asking us. And I do think that clarifies a lot of things for them. But again, I mean, I won't take any much more of your time, but thank you so much. And thank you to both of you for all that you've done for students of St. James, but generally speaking to the greater IMG community and helping out as much as you can. Thank you both for joining us in the program.
Thank you.
Thank you so much for tuning into our show. We hope you enjoyed another episode of Med School Minutes. If you like our content, please follow us and receive notification when a new show is posted. This podcast is brought to you by St. James School of Medicine. For a video version of this podcast, please check us out on sjsm.org/video.